Hello, my name is Dr. Howard Goodman, and I'm a chiropractor who works for NY Rehab Pain Management and Medical Services PC. The focus of my work at NY Rehab is to help patients with severe herniated and bulging discs and sciatica that is actually causing a tremendous amount of pain, and the patients that we work with are really trying to avoid surgery at all costs. The focus of my particular end of the practice is using spinal decompression and other machinery and technology that can help to reduce the size of a herniated disc and actually increase the muscular strength around the spine so that the patient can go back into a normal, healthy, pain-free way of life. Some of the first symptoms a patient might feel is some stiffness, some soreness, what they might consider to be an occasional backache. What ends up happening in a lot of cases is you would have what we call a radiculopathy, or a radiating pain from either from the neck going into the shoulder down into the hands, causing numbness and tingling, or most commonly in the lower back you might have some discomfort radiating from the lower back down into the leg and into the feet, causing numbness and tingling. A side view of a spine, what you would see in an MRI, you have actually the brain stem and the spinal cord. Here's the discs in the spine, here's the bones. In a herniated disc, what happens is the disc goes backwards and actually presses on the spinal column. Our goal is to actually help to resorb that disc and actually pull that disc back into place using special non-surgical techniques called spinal decompression. The special machinery that we have, the spinal decompression machines that we have, allow us to use a computer in the machine that has a brain, if you will, that measures the body's response when the patient is being pulled, and when the body's responding too much and resisting, the table can slowly overcome that resistance very gradually, therefore allowing a better separation of the tissue and a better rehydration of fluid around the spine back into the disc so that the disc can better resorb and resolve. A lot of people feel pain relief in a very short amount of time. Again, I want to make it clear it's not for every person, and there's no guarantee of results with any therapy you do, but we do have a high success rate, and we do have a lot of experience. So the experience that we have, seeing over several hundred patients, has given us a real good factor in determining what's going on with the patient to see how they will respond. We constantly monitor your progress throughout, so that we should be seeing results in a short amount of time, usually between 6 to 8 weeks completely, to get the patient back into a normal, reduced pain or pain-free lifestyle.